If you run a treatment center on a SimplePractice alternative built for solo therapy, you may be billing CMS 1500 claims when your IRP and residential programs need UB04. A platform built for one clinician and one chart was not designed for groups, multi-provider care, and facility claims. SimplePractice versus Behave Health. Here's how the two platforms compare for treatment center operators across CRM, clinical documentation, billing, and operations. We walk through admissions, clinical documentation, revenue cycle, and the operational tools that facility-based programs depend on. SimplePractice appears designed for solo clinicians and small therapy practices delivering outpatient one-on-one care. Based on publicly available information, the platform focuses on individual therapists and counselors who need scheduling, simple billing, and basic notes. Behave Health is purpose-built for facility-based behavioral health and addiction treatment, including IOP, PHP, residential, detox, and recovery residences. If you operate groups, bill facility claims, and coordinate a treatment team, an outpatient therapy platform forces clinical workarounds that compound over time. SimplePractice appears oriented around CMS 1500 professional claims, UB04 facility claims required for IOP, PHP, residential, and detox may not be part of the product. Group documentation, multi-provider charts, and Part 2 controls are difficult to retrofit onto a platform designed for solo outpatient therapy. UB04 facility claim submission is core to Behave Health's RCM module, designed for organizations that bill IOP, PHP, residential, and detox. Behave Health is designed to submit UB04 facility claims with payer-specific configurations and CMS 1500 professional claims for outpatient providers inside the same platform. Real-time eligibility verification at admission and before sessions is designed to confirm benefits before the work begins. 4 areas decide whether a platform fits a treatment center: admission CRM, clinical documentation, facility billing, and operations. Let us walk through each one the way a facility-based operator would evaluate it. Area 1. The admissions CRM, where most facility revenue is won or lost. SimplePractice appears to offer scheduling and client management built around a solo therapy practice. Multi-source lead tracking and referral analytics may not be core. Behave Health includes lead capture, insurance verification workflows, referral source tagging, pre-admission assessments, waitlist management, and native alumni tracking. Area 2. Clinical documentation built for the realities of addiction treatment. Behave Health's EHR is designed for group documentation with attendance tracking and per-patient progress notes inside a single group session. It supports ASAM assessments, COWS and CWA withdrawal scoring, and multi-provider charts with role-based access, workflows that may not be core to a solo therapy tool. Area 3. Revenue cycle, the single most important consideration for facility-based programs. Behave Health's RCM supports UB04 facility claims with required revenue, value, and condition codes, plus per diem and bundled rate billing. ERA and EOB processing, denial management with appeal tracking, authorization tracking, and aging reporting are designed for facility revenue cycles. Area 4. Operational tooling, where Behave Health diverges most from outpatient therapy platforms. Behave Health includes property management for recovery residences and vehicle management for transportation programs, tooling SimplePractice does not appear to offer. HR management and maintenance scheduling consolidate operations into the same platform as the EHR and billing system, reducing software sprawl. The clearest line between the two platforms is the claim form. Solo therapy submits CMS 1500. Facility programs need UB04. SimplePractice appears oriented around CMS 1500 professional claims, the correct form for solo and small group outpatient services. Behave Health supports both CMS 1500 and native UB04 facility claims, because UB04 programs need billing software designed for it from day one. Behave Health includes controls designed to support customer Part 2-oriented workflows for SUD records. If you are outgrowing solo therapy into IOP, PHP, residential, or recovery residences, Behave Health provides a structured migration path. Behave Health's team handles data migration, staff training, and parallel go-live support, so the transition does not disrupt operations or revenue. The platform is designed to grow with you, rather than around you, as your programs expand beyond outpatient therapy. Behave Health combines CRM, EHR, RCM, and ERP, so admissions, documentation, billing, compliance, and operations live in a single source of truth. The CRM connects to the EHR, so a lead becomes a patient without duplicate data entry into the clinical record. UB04 and CMS 1500 claims, real-time eligibility, and denial management are designed for facility-based revenue cycles. Property, vehicle, HR, and maintenance tools give leadership a single operational view alongside the clinical and billing data. Stop forcing facility workflows into a solo therapy tool. Book a 20-minute demo at behavehealth.com. See admissions, group documentation, UB04 billing, and operations built for treatment centers at behavehealth.com.